Welcome to Roots and Resilience. I'm Dr. Tejal.
And I'm Dr. Nehal. We have had some incredible conversations with inspiring individuals that we feel compelled to share with you all.
Listen with an open mind and an open heart. You never know, you might just pick up a pearl that might spark something in you.
Enjoy.
Welcome back for another episode of Roots and Resilience. We are delighted to have with us Poonam Shah. She is working as an inclusive eye health advisor for an international non-government organization, and she has a background in hospital optometry. I'm really looking forward to this conversation because we're going to delve into her journey from sort of clinical work into more public health type work. Um, and so, without further ado, Poonam, welcome to Roots and Resilience.
Thanks very much. Thanks for having me.
Wonderful. So your journey started off in Uganda, if I'm not mistaken. So talk to us a little bit about that aspect, or that's your childhood, and who's in your family. What was it like growing up there?
Yeah. So actually, it starts in the UK is where it starts.
Well,
So,
there I stand
to,
corrected.
yeah. So I was born in the UK, and so was my brother, and then yeah, moved over to Uganda when I was 3. My brother was only 9 months. Um,
Sorry, I'm going to interject there. So I know there was this whole, this is my ignorance, but there was this whole political situation in the 70s with Idi Amin and a lot of Asians who had to leave Uganda very, very sort of suddenly. Um, so why, and then since then, I've never heard of anyone actually actively moving to
Like
Uganda.
the other way, going back to Uganda. That's
So is it
interesting.
yeah.
because you had family roots there that stayed on during that time that you had like how just talk to us about that bit.
Yeah, so partly. So yeah, so there was a mass sort of exodus. A lot of Indians were overnight sent out of the country, and it was, I think, very distressing, naturally, for a lot of people and families. And my parents decided to go back because my uncle went back. So after everyone had been sent away, at some point when things settled down, the then president came back to the UK, came to the UK to kind of invite a lot of Indians back. So there was this period where a lot of people were kind of thinking of going back to kind of reestablish businesses. I think for the people who it was very traumatic for, who had left everything, I think they found it really hard to go back. So a lot of them have never been back.
Mm.
I've heard some people don't even like talking about that period. But my uncle, um, their family sort of went there to establish a business. They had links in Kenya, and then we followed because there were good business opportunities. So my dad and mom decided to go there and establish a business, really. So
So were your mom and dad like were they both originally from Uganda then had to leave Uganda?
no, so they actually never lived in Ghana. My dad was born in Kenya, in
Right.
Mombasa. So yeah, there were African links there.
Right.
So he then moved. So my parents have moved a lot as well. So my dad was born in Mombasa, and then at the age of 6 moved to India. So he studied in India for 10 years. So his childhood was there, and then moved back to Kenya um, when he was about 16 or 17, I believe. Um, and then my mom grew up in Mumbai in India, but her dad had been in Kenya for a little while. So there was still some African, Indian sort of roots there. Um, and then she moved to Kenya when in her 20s to join her brother there, so my uncle. And that's where they met. My parents met and then got married, then moved to the UK, and then moved to Uganda, then moved back
Right.
to the UK.
So they your parents made the decision to move to Uganda based on your uncle moving there, not that they had any personal links to Uganda at all.
No,
Right.
So
no.
it was
Okay.
it was an intentional kind of
Yep,
opportunity, business opportunity move, basically.
that's right. Yeah,
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 fine.
Okay.
Which is really important then because you want to be stable and establish, especially when you've got a young family.
that's it. Yeah.
So
Mm.
tell us about your time in Uganda.
I love it. I love reminiscing about it. I think it was amazing growing up in such a country where it's always warm, it's lush, everyone knows everyone. The communities are quite small, very integrated. Also, I think when you're kind of like expats, if you may, in a small place, everyone kind of comes together to form links. So there was a very vibrant Indian community as well and religious community, but also even just with the locals, everyone was just very friendly.
So we're
Um,
talking about the 90s, right?
yes, early 90s,
Right. Okay.
90, well, actually, no, 96 is when they moved over,
Fine.
1996. Yeah. That gives away my age, I guess. But yeah, so it was really lovely growing up there. Playing outside, um being free, I guess. Um we did a lot of trips, like field trips from school. We saw our friends not just at school, but also on the weekends, at like community events and things like that. It was just fun. It was very outdoorsy. It was very out in the nature. We used to do like play in the rain and things like that. Like, it was something you could do there. So yeah, it felt like a very like a brilliant upbringing.
Did
Um,
did you were you based whereabouts in Uganda were you based?
so we were in Kampala, which is the capital city,
Hmm.
um, in a place called initially Naguru, for people who might know that, and then Bukoto. So a lot of people might have heard of Kololo, like Kololo Hill. I think it's kind of prominent in a lot of books, but also with the whole Idi Amin time. So yeah, not far from there. We lived in that sort of area.
And did
Um,
you explore other parts of Uganda when you used to live there?
yeah, quite a bit. So either through field trips
Hmm.
or just with the family, and we had lots of family friends. So lots of people that we had as like family, but were actually friends. And so, yeah, we went to Jinja, which a lot of people know. It's another
Mm.
city where it's the source of the River Nile. We'd done like whitewater rafting and quad biking and all sorts there. So there was Bujagali Falls over there. So that was a common spot for picnics. So that could just be like a day trip, or sometimes weekends. We did camping trips from school to Jinja very often, which was a highlight. And then, things like Murchison Falls, Bale, done sort of hiking in Mount Elgon, which is kind of the border of Kenya and Uganda, Sipi Falls. So yeah, so all around Queen National Parks, of course, wildlife as well in Africa is well
Hmm.
known, and not just in Kenya, but in Uganda as well. So yeah,
That's amazing. I love it. Your field trips are so lush, they're so exotic. Do you miss Africa?
I do. I do. I think it's more the way of life. It's just a very
Mm.
laid back, and that community feel. I don't think you ever felt alone. Um, so yes, I do. I
Did
do
you ever
miss it.
feel unsafe or as like a girl growing up there, did you feel like, there had to be measures in place, like for what some things that I take for granted often is just, leaving the house any time of day or night, in my car or jumping on a train. And I don't know, like I find when even when I'm in India, sometimes, those little things, those little kind of the freedom to move around just is restricted, and I feel that. But when you were there, did you ever feel anything like that?
So I mean, we were there as children, so maybe it's a bit different in, how you would travel out around independently. So our parents would usually take us around. We were quite privileged in that we had, a driver and a car. So we would actually, if my parents weren't driving, then we'd be driven around. Like school journeys were either being dropped off with a driver or picked up, or school buses, for example. We did use matatus, is what they're called, so the public transport. We'd use those sometimes, but never on our own. We'd usually, because we were young, we'd usually
Hmm.
be
Yeah.
with a parent or boda bodas. So it's a two-wheelers. You could hire a boda boda. It was like for 200 shillings, which you would not get anything for 200 shillings now. But yeah, so you could jump onto one of
So
those
is that
and then
somebody driving it and you're
someone
piggybacking?
driving. Exactly.
Well,
Wow.
Yeah.
that's how I got around Bali, to be fair, because
Yeah.
they don't have a public transport system there, and I was useless on one of those, so I totally
Yeah, so the
relied on.
main things would be the matatus, like minibuses,
Yeah.
which is I think it was 500 shillings. They literally just stop
But would you get onto those as a family, I presume, right? Like the
as a
entire family.
family or with my mom or dad.
Fine.
Uh, yeah, so I think Uganda was relatively safe compared to maybe stories you'd hear in
Mhm.
Kenya. There was always felt a bit
Mm,
unsafe, but in Uganda, actually, we felt quite safe.
that's
So
Yeah.
how long were you in Uganda for? Until what age?
Till I was 16.
Oh
So I
wow.
did,
Okay.
yeah, all my schooling there, and then I did my A levels in the UK. So I moved over actually on my 16th birthday, and did my A levels in London. So
so.
yeah.
So was that always part of the plan, kind of for higher education to come back to the UK?
Yeah. So my brother and I went to an international school. So initially we were in a local school doing the local curriculum, and then moved to an international school. So we did international GCSEs. So we did SATs and GCSEs. So it was yeah, a British curriculum, with that thought in mind, looking into the future that we would do higher education in the UK. So it'd be like an easier transition. So yes, that was always the plan to come and then do A levels in the UK and then university eventually.
And what
Okay.
A levels did you do?
I did maths, chemistry, biology, and psychology as an AS level, and then I dropped that for my second year. So yeah.
Wow. And did you always know what you wanted to do in the future, or how did that come about?
What I did always, I guess I realized when you start picking your subjects in year nine that biology really fascinated me. My mom was like, "Really? You want to cut open hearts and things?" We went for a careers open day thing. And so yeah, I just found it really fascinating how the body worked. Also then I just have a personality where I like to do things for people, take care of people. So naturally it meant that healthcare was something that I wanted to go into. And I think initially I was thinking, interestingly, to do dentistry. Or medicine actually would have been something I wanted to go into. But I was kind of put off it by just how much studying is involved. So I had an aunt as a gynecologist, and she said there's a lot of studying involved. Just think about that. If you'd be up for that. Um, and so yeah, actually initially I applied to do dentistry because my friends were doing it for no other particular reason. It's all I knew. Um, and I didn't get in. So I got the grades. I took a gap year. I applied again. I didn't get in. And then so I thought, okay, what should I do now? And optometry was something I knew as, a good career. Interestingly, I said optometry is one job that I would never do because in my head it was someone sitting in an optician's and optometrist room saying, do you prefer lens one or two? That I thought was the life of an optometrist. I'm like, I don't want to do that. So I kind of landed into it by coincidence. But actually, it's been the best thing ever because I realized there's so much else you can do with it than just what I initially anticipated.
Exactly.
So,
And this is why we were so excited to speak to you because you're almost redefining your role as an optometrist. And I think people forget there's so much you can do outside of the walls of your clinic, outside of the walls of your room. And obviously you're in going into public health things, and actually that would be really nice for us to get into. What made you get into that? How did that come about? Because we'd love to hear about that.
yeah. So, like I said, I didn't want to do these standard optometry high streets, optometrist route, and actually, I didn't even get any offers to do a pre-registration yet because you have to do a year working under supervision before you're fully qualified. So actually, that was a silver lining. I didn't actually get that, but there's another route you can take, which is to go into hospital optometry, which is more clinical, which I found a lot more interesting. So I applied for that with a lot of advice from some lecturers. And yeah, eventually I got um, a pre-registration role in Newcastle. So I did a year in Newcastle at the Royal Victoria Infirmary, which was amazing. So it was a nice year for me living out and discovering myself in different ways.
So when you moved to, sorry, just to backtrack, when you moved from Uganda to the UK, was that the entire family relocating, or were you by yourself?
So initially I was going to be by myself, but the whole family then decided to move. So it was just my brother, mom, and I. And then 2 years later, my dad sort of moved. So he
Okay,
sort of wound up the business and moved over. So it was the whole
right.
family.
Right, okay. So whilst you were doing your A levels, you had family around you. And then where did you go for uni?
London. I went to City University in
Huh.
London. So
Okay,
actually, I just commuted because we were living in London at
yeah.
the time.
So
Um,
Newcastle was like your first kind of on your own type,
ev-
being out there
exactly,
on your own. Okay.
exactly. And my parents were very much like, "Are you sure you want to go that far away?" But it's the best decision I think I ever made because it really opened up my horizons and yeah, opportunities for me actually. So I
Yeah.
had a really good year there. And I would have stayed in Newcastle, but they didn't have a job after the pre-registration year. So after I was fully qualified, I then obviously started looking for different jobs and thought, okay, let me look for something closer to home. And eventually got something in Cambridge. So I moved to Cambridge. So I worked in Cambridge University hospitals for 7 years, where I learned a whole deal. I did lots of different things because I was interested in lots of different
So what
aspects.
kind of things were you like seeing and dealing with in the hospital setting?
So in Cambridge University hospitals, it was more clinically oriented. So there was seeing things like medical retina. So it was working in an ophthalmology department. So there's no optometry department per se, but it's sort of
Mm.
integrated with ophthalmology. So we'd be working alongside the ophthalmologists to do yeah, medical retina clinics, diabetic retinopathy clinics, so assessing for conditions in those parts of the eye. Um, I also worked in glaucoma clinics. I've done some extra qualifications and I'm an independent prescriber as well. So as an optometrist, you can't usually prescribe ophthalmic medications, but if you do extra qualifications, you then can do. So I've done that to supplement everything. Cataract clinics. I've done a whole host of things, pediatrics, research, clinical research,
Lots of
cornea clinics, I've done some eye emergencies. I've done a whole load of little things.
so
Yeah.
lots of variety.
Yeah.
Lots of
And low
variety.
vision, of course. So these are people who have poor vision that cannot be corrected. So how do you
Mm.
support
Yeah,
people with
yeah.
that?
So
So it's
what
like the most more complicated cases going to the hospital, right?
That's right. Yeah.
so
Yeah.
what did those 7 years working in one place, doing all these different things, what did that teach you?
Um, I think it gave me an opportunity to be consistent to start off with. So really seeing how things changed over time. But also gave me an opportunity to grow as an optometrist. I think being in one place, being known by, you know, my colleagues and peers, and I guess being reliable as well, you get those opportunities. And my manager was amazing in that I never had to think about my own development. She taught me a lot. I still think of her as my mentor. So she kind
Mm.
of, yeah, very strong optometrist, very driven. And she kind of would ask me, okay, so what's the next course you want to do? What's the next thing you want to do? And I wanted to do so many different things. It's not like I had a focus, just medical retina, let's say, or glaucoma. And she kind of accommodated that for me. So I think that was the benefit and having that relationship. So I really look up to her and I'm really grateful for her, really. So yeah, I guess
Did you see
That's really
yourself?
cool, actually. Sorry, Tejo. I know, like, even when we've been in certain training posts, there is always either one person or a few people that are mentors that you really take to and you can really learn from, and have their, have they have your genuine kind of interest and growth at their heart as well. So that's a really nice to continue building those relationships. And I would say for anyone in a training post, ask for help, speak to your supervisors because often they want to help you and they want to see you grow. So that's really nice,
yeah,
actually, expressing gratitude for your mentor. I'm sure she's
yeah,
really proud of you as well.
yeah. I think uh, one good thing was actually, I guess, so the potential in me. So when I applied, was applying for an like extended optometrist, specialist optometrist role when I
Mm.
had been newly qualified. But I, of course, went in there, the interview, and she said, "Look, you're not really qualified for this position that you're interviewing for, but I can see that you have potential." So she created a position for me. She said, "I'll train you up at this level, and then by next year, I'll put you up." And she was, she stood by that. So
And this
I
is the
really appreciate
benefit of
that.
actually going for jobs and
Yeah.
posts, even if you feel, you're not 100%, qualified for the role, because exactly what you said, because if you have the right attitude, they see your potential, then the opportunity will work out, or it will be tailored to, to your needs to
You
get
have
you to where
nothing,
you need to go.
you kind of have nothing to lose, right? So that's the
Absolutely.
attitude I usually
Good for
take whenever
you.
I do this. Yeah.
Yeah, no, well done for doing that. And then you're there for a good 7 years. And during those 7 years, did you think, okay, well, I could, you saw yourself staying there indefinitely, or like, what was your plan at that time, or if you had one, when you were looking ahead, being like, okay, I'm doing lots of different things in hospital, I'm really kind of growing. Did you see yourself staying as a clinical, in clinical, doing clinical work in hospital settings indefinitely for your?
Um, I think I did. Because I really enjoyed it. I really enjoyed my job. I loved the setting and the people that I worked with. I think that made it more than anything else. We kind of do know the stretches and confines of the NHS and working with the NHS, but it's the people that really make it. And I think that for me was really valuable. Um, I think my manager did see me taking up leadership positions, so she kind of had a progression in mind. But I wanted to travel. And I think after the pandemic happened and I thought, okay, now things are a bit settled. This is my opportunity. So I'd been saving money. I had wanted to travel for a long while. And I think it just came as an opportune moment to take a break and go do something that I'd wanted to do for a very long while.
So did you
So
take a
did you
career
take like
break?
a sabbatical, or did you leave the job and then decide to travel?
So the interesting thing is, saying everything I said about my manager, she was very supportive and she offered me a sabbatical for a year. But at the time, I wanted to travel for longer, and there were other personal circumstances. I was hoping she would give me longer, but she said, "Look, you have to be back in a year's time." Um, and so I decided to quit, which was very hard for me, very hard. I had to send her an email. I couldn't tell her in person because I knew she would react. Um, but I had so much support from my colleagues around me saying, look, these are things you can't do in life all the time. You're getting this opportunity, go do it. My worry was, will I lose all the skills that I'd gained and all the knowledge that I'd gained? But actually, those things you can always like learn and get back up to scratch. And the the world of optometry, I don't know how it is for dentistry, doesn't change that much over a space of 2 years, let's say. So if I really wanted to, then I could just catch up and come back, really. So my colleagues and my friends really encouraged me. And yeah, so they were very inspiring. Yeah.
Wow. So you wanted to travel for 2 years.
I wanted to travel for 2 years. I'd been saving money for a very long time. And this was my moment. So yeah,
Wow.
my plan was to travel as long as I could. So I had a budget,
Uh-huh.
and tried to make that, stretch that as much as
So
possible.
where did you go?
So I started in in Canada, because I had a friend there who I grew up with, and she was getting married. So that was my first destination. But before her wedding, I traveled in Alberta, um, for about 2 weeks, and I went to Yellowstone National Park for a week. That was my first step into properly solo traveling. I'd done a little bit before, but this was, yeah, yeah, a whole new horizon. Then I went to her wedding, then came back to the UK, worked a bit. I did a bit of locum work to kind of make some money back up after traveling in Canada and the US, which is quite expensive. And then I went over to Asia, so into Southeast Asia. So I had a one-way ticket to Bangkok, and I'd booked 3 days in a hostel, and that's all I had arranged. And then I sort of winged it as I went along. Ended up spending a month and a half in Thailand, a month in Laos, about 3 weeks in Cambodia, 3 weeks in Vietnam, and 2 months in India. And I would have carried on, but an opportunity arose, which is this public health role. So I guess if I can talk a little bit more about the public health aspects, because you'd asked me that before. So I had an interest in volunteering as an optometrist and my skills as an optometrist. So I always kind of, I guess, growing in Africa, growing in those communities, we did a lot of charity and support work, which is also part of my childhood. We did a lot of community activities like that. So that was kind of something that I wanted to offer back. Um, but I found it really hard to arrange. So my idea was when I was traveling that I would go and work in communities and offer my skills as an optometrist, but I found it really hard to arrange. But I had contacted various charities to see if I could work with them, and the organization I work for now um, was one that kind of tried to find me some places to work, but didn't manage. So when I was in Laos, I approached the office, the head office, I kind of just to say thank you for trying to help me. And that's when they said, actually, there's a position available. If you're interested, then, do apply. And I did. And then here I am.
So,
So what was
so
the position?
So the position was for an inclusive eye health advisor. So the organization works in disability inclusion. Um, so I had kind of started paving my way into public health, and that I knew I wanted to go down that route. I think for me, realizing, especially working in diabetic clinics and some of the clinics I was working in, that actually, prevention is better than cure. So if I could work towards systems and how to approach systems, that's somewhere I felt would be quite impactful. Um, so yeah, I naturally started doing some courses in global eye health. So I'd already kind of got some background qualifications. I was already looking into it.
was
Some
that
op
because you were just genuinely curious, or is that because you thought, actually, do you know what, long term, there is like a a desire to explore an avenue in public health?
Yeah, it was that coupled with just wanting to use my skills to give back.
Hmm.
Because actually eye health is one of the biggest um, preventable blindness and vision loss is something that is very easily um, curable or treated, but there's just no services out there or poor access. And I thought, here's me who can offer some support and skills. So that was really the drive and the will. And there were other things that happened along the way that kind of had planted these seeds in my mind to say, this is something that would be very impactful as well.
Hmm. So
Yeah.
this opportunity came and you encouraged to apply for it. You did apply for it, even though you're in the midst of your traveling. Um, and then what happened?
So
Obviously got offered the position. Did you not feel like, oh, I want to finish my traveling and then start, or were you forced to cut your travels in order to start this job?
So again, that same thing, philosophy applied that, I had nothing to lose. And, if had I not left my other job, I don't think I would have applied. So for me, it's a silver lining.
Mm.
Um, I think, yeah, I just went into it thinking, let's try. So I applied. I had to kind of do my CV up again because I hadn't applied for a position for a long while. Um, I had my first interview when I was in Vietnam, like a formal interview. I then had another one. I was in Rishikesh in India, which is like the more formal. Sorry, the first one was informal, the second was formal, and it was advertised as a full-time position. And as soon as I finished that interview, I thought to myself, hang on a minute, if they offer me this job, am I ready to go back into full-time work? Because my idea was I wanted to be traveling for 2 years, right? Um, so that was kind of, yeah, something there on my mind. But they offered that position to someone else, but they created a part-time position for me. So a month later, they contacted me saying, actually, we'd like to offer you, I think it was 18 hours or something like that. And I thought, okay, that's perfect because I still get to, have some time to myself and not go back into full-time work. And So yeah, I did cut my travels short. In theory, they could have kind of shipped my laptop to me because it's a global health role. I could have still carried on traveling, but I decided to come home and then kind of start afresh. But I still travel. I still travel a whole load, but for different reasons now.
If you're enjoying today's episode and you are a female dental professional, we'd love to invite you to our monthly face-to-face coffee morning.
It's a safe, supportive, intimate space to connect, share, and grow together.
You can express your interest by filling in your details through the link on Dr. Tejal's link tree. You'll find it in the show notes.
Now, back to the episode.
So tell us about your role now. So you had a little bit of, dabbled in a few courses around public health. Now you've actually landed this job in a global organization in exclusively, in pure public health. Like, did you manage to find a mentor, or like how did you navigate this in very different sort of
Yeah.
career move?
So I guess it was a lot of conversations with my manager, he's a public health specialist. He's worked in global eye health for 20 plus years. Also, lectured. And so he had that kind of background of mentoring people and students, master students, and his university role, that kind of thing. There was also, of course, the person who got the full-time position, who's also another inclusive eye health advisor who also has a lot of experience. So I had this conversation with him saying, and I had put this disclosure in my application saying, I know I don't have 5 years experience or whatever they were looking for, but everyone has to start somewhere. So they were aware that there would be, a learning curve and it would be a very steep learning curve. And it was very steep. I found, you know, it took me a year to really understand what my role was because it was just very broad, very varied, but very different to what I was doing before. Suddenly I wasn't seeing patients in the way that I usually would. It was all about policy reading and programmatic work. So, I was put on some courses as well. So I joined some more online courses on programs in eye care as well. So there was some foundations built, but a lot of it was just learning on the job,
Mhm.
which I'm still learning, of course.
And so what does your job involve now? Like, what does a typical day look like for you?
So we work in 12 low and middle income countries. And usually it's a federation that I work for. So it'll be a 3 to 5 year project. It's in inclusive eye health, which is disability inclusion. And there'll be specific activities that are planned. So it could be providing cataract surgeries or glasses, but a lot of it is around system strengthening. So it'd be training local staff so that there's sustainability. It could be developing or supporting a course. It really depends on what are the needs on the ground, and we work with local partners. So we don't do direct implementation of these activities. We work with like let's say an eye hospital on the ground, or it could be a university. It varies, or blind society, let's say. And so they develop activities and as a whole plan over 3 to 5 years on how to then deliver these activities to build up the services. So my job is to review project designs and say things like, have you considered these aspects? And if you do this, that will happen. And then when the project is being implemented, to also provide advice as well, as that goes along. So it's more technical advice.
So it's more kind of,
Wow, it's like consulting, like strategy, right? Like kind of like planning, consulting, looking at the execution, maybe an element of managing as well. It's completely different to clinical. How interesting.
do
Yeah,
you miss the clinical?
I really do. I think because I work on a computer now and I have an open schedule, I've had to learn to time manage. I didn't have to really think about it before because my patients were all booked for me, and so I'm still struggling with time management. It's very hard to work virtually. So when I'm not traveling and, monitoring or training when I'm on the ground, I'm on a computer at home and I miss the personal interactions. I think that's what makes me tick as a person. So that's a struggle, especially when your team is across the world as well. So it's not like I can just you
go
know.
into an office and everyone's there and you can, catch up face to
Mm.
face.
Or
Yeah.
like catch
Yeah,
up
yeah,
coffee. But I
Do
suppose you do have the option if you wanted to maybe locum or like, do a day clinical
that's right.
now and
That's right.
again.
And I have been doing that. I still work at the hospital in Cambridge. I do some bank work every now and again because I work part-time for this global role and I get a lot of leave when I'm traveling, sort of time off in lieu as well. So I've got a good deal, I suppose, where I still get to keep my foot in clinical work,
Hmm.
but on my own terms, I suppose. So that's the difference,
Yeah, and I
when I
think
want
that's
to.
a really powerful phrase on your own terms because I think careers in healthcare can be very draining physically and emotionally, and it's really, really positive that I think you
So I think what Noel's going to say there is really positive, that it's that you can kind of do best of both. You can still have your hand in clinical. You don't have to give that up entirely, but you do it as and when it fits your schedule. So you get your little dose of, that patient contact, and then you've got this other really kind of amazing projects that you are a part of as well. Now, in terms of global health, now public health, I've done a bit of volunteering, and when I was out there, it got me thinking more about kind of global health and change and all of this thing and where I was volunteering it was a place that traditionally was kind of cut off from society. It was all in its little bubble, but since things have become more accessible, there's been like the sugar and epidemic, where it's so readily accessible, and people are addicted to it, and they just don't have the education to make more informed choices. So naturally, the kids and their teeth are in a pretty shocking way, because the education's not there. The sugar's got there before the education. Now, so I was a volunteer there. I was there for a while, but people who are there for like a season or and could come back year upon year, who are trying to influence change. Change is slow. Like you might have the best intentions, to I want to, help, da, 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 da. But when you're working in public health, often you don't actually even see the fruits of your labor, or you don't even actually see the change that you want to see, or that you're working so hard towards, or that you are investing so much of your time and energy. Is that something that bothers you? And if it does, how do you manage that and still keep on going?
So yes, I think one of the first things I said to my manager is when I'm working clinically and I've seen someone, I've helped them with a condition or treatment or glasses, even let's say, it's a direct positive reward or enforcement, of course, for the patient, but also for you as a clinician. And you see the impact directly. Whereas when you're working in public health, it's often, like you said, it takes years, right? So something you implement now, you will see the impact over 2, 3, maybe 5, 10 years down the line. Um, and I had this conversation with my manager. So how do you deal with that? So the question you asked me, I asked him that, and he said, the difference is that the impact you'll be making only not for the one person, but for
mm,
millions. And you've got to kind of have that insight. I guess for me, when I do get to go into the communities that we work in, when we go for country visits, we're taken to the areas where our projects happen. It'll be like school eye screening, or it'll be community screening services, or we get to see local hospitals that we're supporting, let's say. That for me is where I I can see the impact happening on the ground. Of course, when I'm in a sat in my on my desk behind a computer, it's very hard to visualize. But when I go there, I do see the impact there as well. So I guess I draw on that. Um, so yeah, it's trying to see the bigger picture.
Yeah, yeah, I think
do you
you've got
think
to.
it's changed you working in public health?
Definitely. Okay, I hate to say this, but I felt like a know-it-all. It's kind of like, but why don't you do it this way? Oh, it just seems so easy, if X plus Y equals Z. But you don't realize that there are so many other factors that influence the decisions and, you know, oh, okay, there's a policy in the government, or there's barriers to access or poverty, or, things like that, other things that are less obvious, I suppose, that you realize that there are all these other barriers, and that's why things aren't as easy to change, you know? So I think it's been a bit of a reality check. I think when you're sometimes sat clinically as a clinician thinking, well, why are we doing this process in the way that we are? Because I don't know, our bodies, our governing bodies might have, we don't realize just how much effort they've put into how much liaison happens in the background for us to get something. So yeah, it's made me appreciate that a little bit more, but also become a bit more humble. Um, and just trying to, take a step back and also understand there's only so much we can do, which is
Mm.
really hard. You want to go and change the world, but yeah, sometimes there are some barriers you just can't overcome, and you have to be okay with that.
Hmm.
Wow. Thank you, Poonam.
Yeah. Which countries that you said 12 countries that you work
Mm,
with? So I presume these are the countries you travel to when you need to.
yeah.
Which countries are those?
So the main countries that I am like sort of a focal point for is Bolivia in South America, the Philippines, and Laos, which is where it all started. But the other countries we work in Africa, Zimbabwe, Kenya, Madagascar, Nigeria, Burkina Faso, and in Asia and Asia Pacific, we're also working in Nepal, Indonesia, Bangladesh, and Papua New Guinea. I
Wow.
think I've covered all of them, but yeah.
Oh wow.
Wow. Really random question, but are there different kind of in these different regions, are there different I suppose eye issues that are more prominent in some regions versus others?
There can be because of lifestyle choices, also ethnicity, demographics and that kind of thing. But largely, the largest causes of blindness, irreversible vision loss, and vision impairment is poor access to glasses and
Mm.
cataracts. So people just not having a pair of glasses, which sounds crazy because it's such an easy fix. But
So what you're saying is
yeah.
so people in okay, again, very ignorant thing I'm just going to ask is if you have, you're either short or long-sighted and your vision is not corrected, are you saying that your vision is going to deteriorate over time?
Um, that varies. But it's just the fact that for example, you're wearing a pair of glasses. If you imagine that you didn't have your pair of glasses, in effect, you're visually impaired,
Hmm.
right?
Mm.
So that's what I'm saying. So just you having access to those glasses changes a whole host of things, education, employment, just like your lifestyle, right?
Could it lead to blindness?
Uh, so there are some conditions like short-sightedness that now is progressing a lot more. So in especially the East and Far Eastern regions, I think it's like statistic is like by 2050, half of the population is going to be short-sighted, which can then lead to pathological changes in the eye. So yeah, that can lead to blindness, and that's because of various factors that population is becoming more short-sighted.
Hmm. Wow.
So
Yeah.
interesting, isn't it? It's fascinating.
But what I found really surprising, Poonam, is that I know in a lot of um, sort of developing countries that eye camps pop up
Mhm.
here and there, and it's a big it's these initiatives exist. What I find really interesting is why is it so difficult for a volunteer, say with a UK qualification, to offer their skills to these projects? What's the red tape around it? Why is it so tricky?
So I think for me, it was that the countries that I wanted to go to which are in Asia, the government has restrictions. So I couldn't just go on a tourist visa and offer services because, they have systems in place. They have to make sure that there is no other people who can offer these services locally, compared to bringing someone foreign. It might be different in other countries, but I wanted to kind of be by the book about it rather than just going
See.
as a tourist and offering services for free. So
Mm.
Um, yeah, that's it more than anything. So with the camps and things, of course, that's great, but it's not sustainable. And I think that's my issue. And I've seen that now in some of the countries that we go in. Of course, we do outreach camps as well, where we
Right.
offer free surgery, but the key is trying to integrate that into public systems.
That's so
Um,
interesting.
Mm.
That's so true,
Which is
actually,
so hard.
because actually, I think, people's like, okay, everyone wants who wants to help and contribute or, potentially wants to donate money. They'll be like, yes, I'm going to host an eye camp for this particular community. But what you're saying actually is that eye camp, ad hoc is not a sustainable option. So would you rather not do that and you collect that money and put that into where would you then direct that money then, if that makes sense?
to charitable organizations, non-government organizations who work on systemic change. Um, I'm not saying it's wrong to do it an iCamp, but do it through an organization. So fund one of the iCamps as an activity that that organization provides, because there's other things that they also develop that surrounds that one camp. It's not just the camp. There'll then be provision of glasses, there'll be training of the clinicians, that kind of thing. So it's coupled with other activities.
Mm,
So you could say put this money towards one of your camps, but maybe provide it, you know, to such organizations. That's maybe what I would
Mm.
suggest. Yeah.
I guess because then there's more likelihood of being some kind of continuity. If something gets picked up, there's a pathway for that patient to then be referred
Mm.
on. I'm just thinking, just
That's
can be
exactly
taken
it.
care of as opposed to being like, right, this is what we're set up to do. This is what we can do. If we can't help you, oh, I'm sorry, you're gonna have to, go somewhere else.
Yeah,
Um,
I mean, I guess if you were to set up a camp like that, as long as you've looked at all of those, that whole pathway, and you've linked up to local service, then that's
mm,
fine. So yeah, the issue is if you do provide someone with a pair of glasses, after 2 years or after 3 years, they're going to need a replacement, or, so then what happens?
mm.
So that's something. These are sort of
Wow.
things that we think about as well.
You really need to put another hat on when you think about this. It's like you have
Yeah.
to think very logically. You can't be emotional about this. I
Mm,
suppose you're thinking logically and you're thinking, what is the way that we can impact the greatest number of people in, at one go almost. Um, which is a skill actually, which is a real skill to be able to separate your emotions potentially from your head and your the logical side of you.
yeah, I think there's two aspects of that. There is, yeah, that being practical and pragmatic about it, but I think you do have to put a little bit of yourself into it as
Yeah, of
well.
course.
Um, because, for example, if you just think about, I guess, universal healthcare, which we're quite privileged to have here. In a lot of these countries, poverty line is, a lot of people live below the poverty line or at the poverty line. So
Yeah.
for you know, for them putting food on the table is a priority, for example. So if you have to choose between that and, I don't know, going to get your eyes checked or buying a pair of glasses, you're going to prefer to put food on the table. So it's trying to develop pathways and ways that you're supporting people financially as well. So, but empowering communities at the same time. So it's a very delicate balance, but you're right, you do have to put a whole different hat on, which I'm still building my hat, if you may.
How long have you been on doing this role? How long has it been?
2 years, it's been just over 2 years now.
Wow.
Are you able to share any highlight over those 2 years? Or something particularly memorable that you worked on?
Gosh, there's a lot. So I visited Nepal recently. So there was a conference there, but also went to see some of the services that we provide out there. And actually in the hospital who's our implementing partner is one that was started up and supported from the ground, from scratch to built up now to, I think, one of the largest in the world in terms of service provision, which is amazing to see. But it's just the systems they have in place to do community screening. They do door-to-door screening. So they'll go household to household and screen people and then refer them to vision centers. And the models are just amazing to see. Other than that, we work on disability inclusion. So it's kind of access to eye care. How do people with
Mhm.
disabilities actually feel included in services and access services? So we've been doing some training workshops on inclusion, so training healthcare staff with organizations of people with disabilities um, on thinking about accessibility in a more whole-rounded way. So this is something I never imagined that I would be contributing towards and working towards, but it's been very enlightening. Yeah,
Yeah, absolutely. I mean, yeah, like you said, you were on such a steep learning curve, but sometimes we don't give ourselves enough credit to say, yes, maybe in your case, like you spent so much time doing clinical work, but you gain so many transferable skills, right? That even though you're now in a majority like you're a non-clinical role, I'm sure that's all coming in useful, and then you build on the skills that you need for your role as well that you may not have had before. So. I think as long as you've got the right attitude, you've got the right sort of mindset and the will to explore that whatever that role involves, um, you'll be all right. Like you'll be okay, even though it's going to be very
Mm.
different. There will be times that it will be challenging. Um, but I guess that's just part of the journey. And
yeah,
I've loved hearing about um what you're up to, what you've been up to. And I was just before we wrap up, just one last question kept crept up in my mind is, so if you go into a country and you see, okay, this model is working really, really well, say in Nepal, for example, could you then go to Bolivia and say, let's try this model here? Or is it just so it's each country is just so unique with their, different separate nuances that you have to tailor, like you have to create a new
Probably their
model based on
policies,
that?
right? Their government policies might be an issue.
that's right. Funding, there are various aspects.
Mm.
But yeah, in theory, that's the beauty of us working in different countries is to have that cross-learning. So yes, we will kind of say to our because we have country offices, we have teams who kind of actually run the project and then we support them. So yeah, we will link them up. We will tell them about models that have worked in other places. But yeah, you're absolutely right. They kind of then have to be tailored to what is possible and feasible in those respective countries. So they might have very valid reasons to say, yeah, that's great that works in Nepal, but actually these are the reasons why it wouldn't work here. Or
Mm.
maybe if we tweak
Yeah,
this a little bit, that might work.
yeah.
Yeah.
But that's also exciting because you get to, I suppose, problem solve a bit and think like how can we include it? How can we make this fit in Bolivia, for example, or tailor it to Laos,
Absolutely. And I think
which
I've
is
had to
really
really,
exciting.
and I still haven't grasped this. So, it takes a long while. It took me so long to even just understand the NHS and the system and how that works, to now have to learn about the healthcare system of all these countries, because as an advisor, you have to have that overall picture to be able to advise. So I'm still building, I'm still putting the pieces together.
Yeah, and there's no manual for this, right? But like there's no book you can go and read to really kind of understand it. I guess it comes from a lot of groundwork, talking to people, just your own experience, and engaging. But how wonderful, how very exciting. Poonam, thank you so much for coming on here and just sharing a little bit about that. I hope, if anyone's hearing, like, listening to this, I hope, I'm sure will have inspired people to think, they can, completely pivot within their profession and still find joy and meaning in what they're doing. Which it sounds like you are very doing something that's very aligned to your own values as well, which is really, really wonderful. Like, I think this is so important as well because often we can find ourselves doing a job. You go into the profession with all the right reasons, but you find your job is just not aligned to, your core values or who you are or what you stand for. And even that can evolve as well. Like our careers are constantly evolving, and it's really important to recognize that, I don't know, maybe the generation above us, we've seen examples where people just go into a job or one company, they stay there and they retire. But you can chop and change, you can pivot, and it can, I guess the dots all join up when you look back, right, as well. So, before we conclude today's episode, Poonam, as per our tradition, would you like to share, if you had to share one key message to our listeners, what would that be?
Um, I guess it would be around, it's never too late to pursue something that you feel passionate about or that you've always dreamt of. Go for it. Kind of life's too short. I feel like live a life with no regrets. Give it a try. It might, you have to try to do it to see if it works out or not. So, push yourself, push your boundaries, and I realize it all works out. Everything does work out in the end, and it's just taking that step back and seeing that bigger picture, which I must admit I forget myself sometimes. But yeah, I think that would be one message that I kind of would like to give your listeners. And yeah,
Thank you
Thank
so
you so
much.
much,
That's
Poonam. You are
lovely.
honestly so softly spoken, yet so brave, and actually have created so many incredible opportunities for yourself. So you should be really proud of yourself.
thank you. Thanks
And
very much.
definitely something to both Tedra and I can learn from you, and I'm sure our listeners too. So thank you for coming on.
Thanks for having me.
Thank you. Thanks for tuning in. If you enjoy this episode, don't forget to hit follow on Spotify or Apple Podcasts and to hit subscribe on YouTube so that you never miss a new one. It really helps if you rate and review the show, and if you found this episode valuable, share it with a friend, family member, or colleague. We appreciate your support and we'll catch you next time. Bye bye.